Now we discuss a case of 62-year female diagnosed with left breast carcinoma, underwent surgery and chemotherapy. The treatment has been completed in November 2020. A year later, which is in December 2021, she came for a follow-up PET-CT scan to our department. So let us see the initial scan. This is a whole body MIP image of the PET-CT scan done in December 2021, which shows physiological tracer uptake in the brain, heart, liver and spleen, urinary bladder, and mild uptake in the bowel loops. Other than this, the other dark spots which we are seeing in the mediastinum and lungs are the pathological sites. Moving on to the transaxials, we see it's an operated case of left breast. So there is no local recurrence at the operative site in the chest wall or in the left axilla, but there are multiple enlarged, metabolically active hyalomediastinal lymph nodes. As you can see, these hot spots. And this one over here with a few tiny lung nodules. This is in the right lung lower lobe, and this one in right lung upper lobe. Also noted another FDG avid lesion in lateral aspect of upper left thigh, which is intensely FDG avid. So after the PET-CT scan, a biopsy was attempted from this lesion, this mediastinal lesion. The biopsy which was attempted from the mediastinal lesion, which I have showed on the screen, turned out to be negative for malignancy. But in view of high suspicion of malignancy based on PET-CT scan, this patient was referred to a higher center. A repeat biopsy from the thigh nodule which I have shown turned out to be squamous cell carcinoma. She has been given palliative chemotherapy after that for a few months, and now she is coming for a follow-up PET-CT in our department. This is a whole body MIP image of the follow-up PET-CT done in May 2022, which shows physiological FDG uptake in the brain, heart, liver and spleen, and urinary bladder. Other than this, all the other sites of disease in the mediastinum, lungs, skeleton, kidneys, and lymph nodes, these are pathological sites. Moving on to the transaxials, we can see there is increase in the disease extent as compared to the December study. There is increase in the size and extent of this mediastinal and lung lesions. This particular lesion is infiltrating into the trachea, causing respiratory compromise for this patient, as well as this lesion over here is obstructing the bronchus, right middle and lower lobe bronchi, causing collapse of right lung middle and lower lobes. Also, there is associated pleural effusion on the right side as well as mild effusion on the left side. In addition to these findings, there are multiple other new findings in the skeleton, these are the lesions in the kidneys. This is the right adrenal nodule. This is a lesion in the tail of pancreas. A few lymph nodes, retroperitoneal lymph nodes. Skeletal lesion again. A subcutaneous nodule in the abdominal wall. A psoas muscle deposit. Few external iliac lymph nodes on the left side. And skeletal lesions again. To conclude, there is disease progression on the follow-up PET-CT done in May 2022. This case highlights the importance of whenever the biopsy is negative in the initial study with a high clinical suspicion as well as high suspicion on the PET-CT, a repeat biopsy has to be done and further management has to be done in all patients. Thank you.